Dr. Azar, thanks for joining us. I just want to kind of remind folks what acetaminophen is, what type of medications you can find it in, and what it does.
So, acetaminophen is what we categorize as a fever reducer and pain reliever. It is an over the counter medication. It's probably one of the most common and widely used over the counter medications for those two purposes. So when we talk about availability of fever reducers for pregnant women, we really are only talking about acetaminophen, which is available and recommended.
Walk us through what we know about what things are linked to autism.
I think one of the most important things for people to understand is that there are over 100 genes that are associated with autism and which increase the risk of autism. Like many conditions, cancers, autoimmune diseases, we usually say that with autism, the genetics are maybe necessary but not sufficient. And so there is an environmental trigger in utero or in a baby's early life that somehow causes this genetic predisposition to actually translate into clinical disease. So different infections, potentially different medication, exposures are things that are thought to be associated with the development of autism, but clearly no one thing has been implicated.
Yeah.
And so certainly there will not be one thing that will be taken off the table that will completely eliminate autism.
I want to talk first about some of the studies around acetaminophen and autism. And the first is this combined study between Drexel University coming out of Sweden, in which they studied siblings over a multitude of years, decades, I believe. And they found there was no link between acetaminophen and an autism diagnosis. What do you make of this study? And how much should we pin on it?
So I think that we are all citing, we meaning medical experts, are using this study as probably the most robust of studies that we have to date. And the reason is that certainly it involves a very, very large population of kids. This is thought to be a very well-designed trial that we could take very meaningful information from because they compared siblings and siblings exposure in utero, which basically can account for some other differences that could otherwise have an impact. So, for example, these are children who are raised in the same environment. They have the same genetics, presumably.
Mm-hmm.
They have those same environmental exposures, and the only different one was exposure to Tylenol or not. And in this study, which again, I think spanned or followed kids up to 25 years, there was not an increased risk of autism that was seen in children who had been exposed to Tylenol in utero.
So, with that, I want to talk about the Mount Sinai study, which
Mhm.
actually has a different outcome. And they have said that there is now a link in this Mount Sinai study between acetaminophen and autism. Can you walk us through that one?
So this was a review of over 40 studies.
Got it.
So this wasn't one clinical trial. Their findings were that roughly half of the studies showed that there could be a potential link, and half of the studies didn't. And they were very clear in their conclusion and in their comments that they didn't want people to take away from their work that Tylenol caused autism, because that is not at all, number one, what they
Mm.
concluded, nor could they have concluded that based on the studies that they were evaluating. At the end of the day, there has been no one study that has definitively shown cause and effect that Tylenol leads to autism, which is why the American College of Obstetrics and Gynecology, reviewing the same literature that you and I are talking about, have come to the conclusion that in the absence of a study that shows cause and effect, they maintain that the prudent use of Tylenol in pregnancy is still appropriate and can be done safely and effectively for women who experience pain or fever in pregnancy in the absence of a better alternative.
Okay, so bottom line here is if I'm pregnant or if my friend's pregnant and they have a high fever and they have pain, should they feel safe taking acetaminophen?
Until an obstetrician tells me otherwise, the answer is unequivocally yes. And if we're talking about fever, especially, Yasmin, there is no doubt that the fever is far worse for the developing baby than a low dose of Tylenol. The same is probably true for a lot of pain syndromes. Pain causes a lot of stress in the mother. Stress during pregnancy is not good for the baby. And it is the opinion of experts who do this for a living that the balance of benefit outweighs any potential harm to the mom or the baby to treat two very important conditions in pregnancy, pain and fever.
Leucovorin,
Yes.
this new treatment that it seems like is being touted as helpful
Mm-hmm.
with children that have been diagnosed with autism. Can you walk us through that? Is this promising at all?
It is. Actually, it is. And I consulted with some pediatricians about this. So leucovorin is otherwise called folinic acid, and it's a precursor to folic acid, which is a very important B vitamin. Some kids make antibodies to their folic acid receptors, which therefore doesn't allow folic acid to get into the brain where it's needed. And so there have been small studies that do show an improvement in behavior and speech and things like that in children who took leucovorin or folinic acid as a
Wow.
supplement. I know. And I don't want to oversimplify it, right? Because it's not going to be like, oh, I've cured autism with leucovorin. It is apparently something that used to be more sort of in the integrative pediatrics world, but has become much more mainstream, and it's safe. So it's not a novel or new or expensive medicine. It's a novel way maybe of using it, but it would be nice to see again a large, really robust, really good study that shows that it truly makes a meaningful, clinically meaningful difference. But in the absence of that, I think it's a pretty benign intervention for families, certainly if you're living with a child with autism.
Dr. Natalie Azar, thank you.
Thanks for having me.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.